If you're studying for the hand therapy exam, do practice questions with me. My name is Huang, and we have my ultimate book of practice questions, and we're going to go over risk today. If you are not studying to become a CHT, then this shit's boring. I'm not going to be offended if you just scroll past, but I will recommend subscribe to the channel and look for other videos that are much more interesting than this one. So I wrote hand therapy exam success for anyone studying to become a CHT. Now I do create a program. It's called the Exam Prep on Demand program, and in that program I follow a very particular curriculum and strategy when it comes to studying. And one of the strategies is, instead of just using practice questions to kind of see where you are, use practice questions to help you as you're studying. So one of the things that I do recommend is you can study, do some practice questions, study and do some practice questions. So today we're going to dive into risks. Let's find some questions on risks, right? Now at the beginning of each chapter, oh my God, hello, it already says right here. So one of the things we do in the book is, because it's so big, at the very top left corner we have the topic, just in case, and we do questions and answers completely separate. So one of the reasons why it's so thick, because she's thick, okay, she's thick. So at the beginning of the chapter, I have written out some tips for you in terms of studying that particular topic. And then we have questions for the risks, and then we have questions and answers. That way you can't cheat, and you're not going in and like learning about something before getting to the next question, because the answers that you are learning could help you with another question. So that's one of the main reasons why we did it separately, so you're not having to like try and not cheat, but also it just allows you to do question, and then go back in and like learn your areas of weakness, learn your areas of strength. Both can help you to be able to study better and faster and not waste a lot of time. All right, so let me share my screen and let's get started on some questions. I'm just going to do about like 4 or 5 questions. And what we're going to do is we're going to do the questions first, and then we will do the answers after. So sorry, you got to stay for the whole call. I'm kidding. All right, let's dive into the first question. Okay, number 1. You have a new evaluation of a distal radius fracture, a closed reduction, and cast for 4 weeks. What are you most concerned with during the evaluation? A, past medical history, history of injury, history of therapy, and work requirements. B, medical history, surgical history, ADLs, and driving history. Past medical history, history of injury, patient goals, limited range of motion. D, doctor's script for therapy, office notes, and sending the evaluation to the doctor's office. If you need to pause and pick your answer. All right, so write it down, jot it down, and then we're going to come back to it. Number 2, you notice your patient with a distal radius fracture and closed reduction is not making gains in wrist extension and also painful in wrist flexion. You request x-rays and notice a malunion that occurred during the healing. What is the significant angulation that you're looking for? A, dorsal tilt greater than 20 degrees or significant intra-articular step off of X. B, volar tilt greater than 20 degrees or significant intra-articular step off. C, reduced angulation of greater than 10 degrees or significant intra-articular step off. D, reduced angulation of less than 10 degrees or a significant intra-articular step off. All right. Got it? Pause if you need. Number 3, a therapist is performing an evaluation on a patient status post a DRUJ disruption. What is the best practice recommendation when examining the wrist? A, palpation and provocative tests are indicated at the end of the examination. What is the best practice recommendation when examining the wrist? Okay. So A, palpation and provocative testing are indicated at the end of the examination. B, the affected side should always be compared with the unaffected side. C, the elbow must be examined to rule out intrinsic causes of wrist symptoms. D, examination must include a thorough history and review of CT or MRI imaging results. Here's a tip. There's usually 2 answers that you can rule out, and then you're left with the last 2, and then you have to pick and choose. Sometimes you have to read the question aloud over and over and pick your, comes down to those last 2 choices. All right? All right. 4, a 40-year-old officer had an open TFCC repair 6 weeks ago and is frustrated with their limited grip strength. They want to know when they are expected to regain full strength. What do you tell them? A, full grip strength typically returns within 6 to 8 weeks after surgery. B, most patients regain 80 to 85% of grip strength post-repair, with improvement continuing for several months. C, their grip strength will return fully within 2 weeks after cast removal. D, if TFCC repairs do not improve grip strength, then they would need permanent modifications. All right, let's go to question number 5. A therapist is evaluating a client with a symptomatic right wrist. What assessments would be appropriate to perform during the evaluation? A, quick dash. B, visual inspection of range of motion of left versus right. C, the press test on the right wrist. And D, MMT of right elbow flexors and extensors. Got your answers? All right, let me see if it updated. Yep, it updated for questions and answers. All right, so let's dive into the answers now, right? So number 1, you're doing an evaluation. So it's asking if you have a new evaluation for distal radius, closed reduction, what are you most concerned with? The answer is C. Oh, I don't know if I can highlight it. C, past medical history, history of injury, patient goals, and limited range of motion. So then you go into the explanation. Now here, you might be tempted to say like, oh, A, you need work requirements and stuff like that. But that's only if you have a workers' comp, case. And so if you tend to, treat people who have work injuries, then your brain automatically will, run to the things you know. But remember, this is an exam that tests everybody, and not everyone works with workers' comp. So it is just about what are you concerned with most during the evaluation. All right. Number 2, you notice that your patient with distal radius fracture is not making gains. All right, so this question is asking, so angulation is really key when you're working with distal radius fracture, knowing like how it's healed, because if you don't get results, then it might be something wrong with the angulation of what they are putting back. So the answer is A, dorsal tilt greater than 20 degrees or significant intra-articular. Is what sometimes which is what will cause that limited in wrist range of motion. So the explanation is distal radius fractures can heal with a malalignment leading to functional deficits and pain. So when you're evaluating the malunion, dorsal tilt is a critical factor. And dorsal tilt of greater than 20 degrees often leads to functional impairments and surgical interventions such as an osteotomy or a corrective fixation in order to be able to restore some of that wrist range of motion. All right. Number 3, therapist is performing an evaluation on a patient's status post DRUJ. What is the best recommendation on examining? The answer is B. The affected side should always be compared with the unaffected side. That's right, with the risk. So it's not that, oh, that's the only answer. It's just based off of the choices here, right? So, keep that in mind if you're like, oh, it should be something else, right? Number 4, a 4-year-old has an open TFCC, right? So the answer for this one is B. Most patients regain 80 to 85% of grip strength post-repair with improvement continuing for months. So, it's just on that page. That's what it says. All right. Number 5, therapist evaluating a client with a symptomatic right wrist. What assessments would be appropriate to perform last during the evaluation? And the answer there is a press test on the right wrist. And it's because provocative tests should be done last. So you don't want to put someone in pain and then do other tests or do other things, because then you won't know, like, was it from the testing or were they just like this? All right. And that was the 5 questions from the wrist. There are a total, it's like 100 questions, I think. So there's more when it comes to wrist. So there are, how many questions? 104 questions. So there's a lot of questions inside the Ultimate Book of Practice Questions, and it dives into, we could be talking about wrists all day. There's fractures, there's ligament injuries, there's different types of surgeries, there's treatments. Treatments include splinting, and so yeah, this is the Ultimate Book of Practice Questions. So if you're studying and you're looking for a resource that can help you just do practice questions, that doesn't tell you the answer, it's chunked out in a particular way that follows my format, because I do believe you can mix it up, but I do believe that organizing yourself in a particular way is going to allow you to make sure that you're covering all the topics that you need, but in a way that allows you to go through all of the topics and study, so you don't run out of time, right? Yes, there's a lot, but you're capable of doing hard things. And believe it or not, I really believe in knowledge stacking. And once you understand certain concepts, you can stack it on other topics, and then it just makes more sense, right? So if you want my help, definitely grab this new book, the Ultimate Book of Practice Questions. There's like 800 questions in here. She's thick, man. She got a lot of questions for you. So yeah, grab it if you need, and let me know if this type of video is helpful. We might do, what's next? Tendons. Might do tendons next. All right.